Hi, I'm Midwife Marley, and today I'm going to be talking about when to call your midwife. If throughout your pregnancy you are having concerns about certain aspects of your pregnancy, then you might want to call your midwife anyway. But I'm going to be talking about some specific reasons to most definitely give your midwife or your healthcare provider a call. So the first one is if you have any vaginal bleeding. It's quite common in early stage of pregnancy, like 6 to 10 weeks, have the odd bit of spotting where it's just a little tiny bit of perhaps brown tears discharge when you wipe after you've been to the toilet. But if you have any bleeding at any stage for your pregnancy, like heavy, bright period type bleeding, then you need to get in contact with your healthcare provider. If after you have started feeling your baby moving, so perhaps most women will feel their baby moving anytime between about 13 and 23 weeks. And then from about 26 weeks onwards, your baby's patterns should start to get a bit more regular, and you should be feeling baby moving every day. If once that happens, you have a day where you're not feeling any movements at all, or you're feeling the movements are a lot less, please don't hesitate to call your midwife. Please don't wait till the next day. Do give them a call and let them know that you're experiencing reduced movements or no movements at all. What will happen is they will probably ask you to come into the hospital just to have the heartbeat monitored for half an hour or so to make sure everything's okay, and then you'll be able to go back home. If you develop any itching, especially on your palms of your hands or on your feet, that could be a sign of a condition called obstetric cholestasis, which is a condition that's caused by the liver, and it's a pregnancy problem, and it only goes away when the baby has been delivered. So if you've got obstetric cholestasis, they'll run some blood tests and things and decide how to monitor you throughout your pregnancy. Often mums who've got obstetric cholestasis may have their pregnancy induced a couple of weeks earlier than their due date. So any itching on the hands or the feet, or severe itching all over the body, then do be sure to give your healthcare provider a call. If you have any sudden onset severe swelling of your face, hands, your feet, it's quite common in pregnancy to get swelling. I have swollen up like a balloon, especially on my feet and my hands throughout all of my pregnancies, but it's usually been a gradual process. But if you wake up one day and your face is like this, and your hands are really big, then that is sudden onset swelling, and that's definitely something to talk to your healthcare provider about, especially if it's accompanied with any epigastric pain, so kind of chest pain, or if you're having any severe headaches, or if you're having any visual disturbances. Any of those things, whether they are on their own or they're coupled up with other symptoms, you would need to speak to your healthcare provider, because one of the things we worry about is a condition called preeclampsia, which is a condition that is caused by the placenta. It causes you to have high blood pressure, and it can become quite serious in some women. So best thing to do is to give your hospital or give your midwife a call so they can get you to come in for further tests. If you notice any unusual vaginal discharge, perhaps it's really, really foul smelling, or it's a funny colour like green, then that would again be a reason for you to give your midwife a call and explain to her that you're having this abnormal discharge, and they might want to do a vaginal swab to send off just to be on the safe side and make sure there is no signs of any infection. If you are having any burning sensations when you urinate, any discomfort when you go for a wee or a pee, then that can potentially be a sign of a urine infection. So rather than waiting till your next appointment, because if you've got a urine infection that takes hold, it can cause other problems. So rather than waiting too much to your next appointment, it's almost worthwhile giving either your GP, your doctor, a call, or your midwife, who will probably ask you to bring a urine sample in that will get sent off to lab for a quick test. If you're generally feeling unwell, you're not feeling yourself, something doesn't feel quite right, something's feeling a bit amiss, perhaps you've been throwing up and you're unable to keep any fluids down, or you just don't feel well, then please do call up, please do call. Don't feel like you can't make contact with your midwife, or don't feel like you're bothering your midwife, or you're bothering your doctor, or you're bothering your healthcare provider. Please don't feel like that at all. Please, if you feel that you've got a problem that needs to be addressed, that something's not quite right, then please don't hesitate to reach out.